Hi guys, in this video we will discuss the Yersinia pestis. It is very important bacteria. Basically, Yersinia pestis is the gram-negative rod related to animal sources. We have started the family Enterobacter, and this is the bacteria of family Enterobacter, and this is related to animal sources, means zoonotic bacteria. And let's start with the diseases. The first of all, it can cause the bubonic plague. You have heard this word plague. It is very common in the USA and the other countries. Bubonic plague means the patient will show in this infection flu-like symptoms. Patient have a fever, body temperature high, headache, pain in the head, and the vomiting start, and it will start from the 3 to 7 days after the exposure. Means the patient will have infection after 3 to 7 days, and these symptoms will appear. Second infection or disease it will cause is the pneumonic plague. In this pneumonic plague, patient will show shortness of breath and chest pain and cough, and it will start also 3 to 7 days after the exposure. So two types of plague in this disease occur in this bacterial infection: bubonic plague and pneumonic plague. So third diseases it will cause the mesenteric adenitis. So what is mesenteric adenitis? Mesenteric means abdomen or tummy, and adenitis mean adenoid means glands, and itis means swollen or inflamed. So collectively it means swollen inflamed lymph nodes in the abdomen or tummy is called mesenteric adenitis. So third disease is mesenteric adenitis. So fourth disease is related to glands, painful axillary lymph nodes. The lymph nodes present in the axilla swollen and very painful, so it is related to adenitis or lymph nodes. And next disease it will cause cutaneous hemorrhages. You see, it is basically skin disease. Hemorrhages mean bleeding occur from the broken blood vessels, and cutaneous means from skin. So skin bleeding it will occur. And next disease it will cause the black death. Black death means gangrene of the fingers, toes, and nose. So what is gangrene? Gangrene means necrosis due to the shortage of blood supply. So it will cause black death. So two types of plagues and three types of skin related diseases: cutaneous hemorrhages, black death, and mesenteric adenitis. So come next, and 25 million of deaths occur in the USA, and this number is very important, and you can guess that infection of this bacteria is so much dangerous, and mostly death occur in this bacteria, in this bacterial infection. Next disease which is not very common in this bacteria, but we have mentioned here, enterocolitis, which is less frequent because other bacteria cause same these disease. Enterocolitis mean inflammation of the small intestine and the large intestine. Next disease is the sepsis, which is not very common. It is also related to other bacteria. Sepsis cause fever, hypotension, blood pressure is low, and disseminated intravascular coagulation means ke between the vessels clots will form, and the septic shock means multiple organ failures occur in the patient. So in this summary of the diseases, we will remember bubonic plague and pneumonic plague, two diseases, and skin related disease, mesenteric adenitis, cutaneous hemorrhages, black death. And not very common disease are enterocolitis and sepsis. So let's proceed. Habitat and transmission. So what is its habitat and what is its transmission? So first of all, its habitat is the animals we have discussed here. It is zoonotic, it is related to animals. So wild rodents is the main reservoir of this bacteria. What is included in the wild rodents? Basically rats and prairie dogs and squirrels. I will show you in the next slides the picture of these animals. You will clear. And next habitat is only these rodents or animals which I mentioned here. So transmission, what is the transmission to human, to animals, animals to human? So first of all, flea bite. Then this is basically a insect bacteria. It can cause infection in the insects, and the flea bite when bite the human, it will accidentally cause infection in the human. So first of all, infection occur from rodents to fleas, and then fleas to human. So in this chain the infection will occur in human. What is mean by flea bite? Flea bite, small wingless jumping insects. I will show you in the picture next, which feed on the blood of the mammals and then transmit its disease through its bites. So rodents to fleas and fleas to human. In this infection, in this way, the infection will occur in the human. So not directly this bacteria infect human. It will infect from flea bite then human. So let's proceed next. And it is also spread or transmit through the pets or puppies. I will show you later. So in this slide you can see that this is the rodents picture, and this is the squirrel picture, and this is the prairie dog picture. So this is the main reservoir of this Yersinia pestis and its diseases. Next we will see what is this is the dog puppy, and this is the flea bite. So these two pictures show the transmission of Yersinia pestis to human. So next, what is the pathogenesis of this bacteria? Basically virulence factor mostly occur. First virulent vector is the envelope or capsular. Its function is protect against phagocytosis, means it prevents the phagocytosis and the bacteria will grow, and it will cause inflammation or plaque or anything we have discussed in the diseases. Next virulence factor is the two antigens, which is V and W protein. Its function is to allow the organisms to grow within the cells. First of all, it prevents phagocytosis, then grow with these antigens. Third virulence factor is the YOPS. What is mean by YOPS? YOPS mean Yersinia outer protein secretes type 3 secretions, and it will involve in the extraordinary pathogenesis. So three virulence factor are involved in the Yersinia pestis, and all the diseases are occur due to these pathogenesis and these virulence factor. So bubu is formed. What is bubu or bubu skin? Bubu is the swollen inflamed lymph nodes which occur during the flea bite. On the region the flea bite occur, the swollen inflamed node is formed, so it will called bubu skin. Next is the exotoxin is also present, which is in virulence factor of this bacteria, and endotoxin is also involved, which is the common characteristics of the family Enterobacter. It will cause fever, shock, and associated with the sepsis. So whole summary of this pathogenesis is the three main virulence factor: envelope, antigen V and W, and YOPS protein. Then two also virulence factor, exotoxin and endotoxin. So bubu is formed, and what are its features we have discussed. So proceed next. Characteristics. What is characteristics? Small gram-negative rods. These bacteria are gram-negative rods but are very small, so you can remember it. Other characteristics is the one of the most virulence. I have told you it will cause 25 million deaths in the USA, so you can understand that it is the most virulent organism. But its ID50 is very low, means 50% of the organism will cause infection. Means that few bacteria will cause the most dangerous infection. It means ID50 low. Next, bipolar safety pin staining. It will show what is bipolar safety pin. You have heard about safety pin, its shape. I will show you in the next slide. Next characteristics is the same like the family Enterobacter. You can mention these characteristics in family Enterobacter, every bacteria. So first characteristics is the facultative anaerobe, means in the absence of oxygen it will act. Second characteristics is the reduced to nitrates to nitrites as a part of their energy. Next is the fermentation of glucose and other sugar molecules. and form the acidic byproducts, and pH phenol indicator red turns into yellow. Next characteristics is the cytochrome oxidase negative, means it will not form the colored compound with indophenol blue. So these four characteristics are same for every family Enterobacter bacteria, and these two are the specific. So next is this is the slide, and you can see that the bipolar staining or safety pin staining is shown of Yersinia pestis here, and this is the slide of histopathology. Next is the laboratory diagnosis. What is laboratory diagnosis? First of all, we will do gram stain, smear and culture. In this test, we will isolate the gram negative bacteria from the gram positive bacteria. Next, we will do the specific test. Gram staining is a general test. Vason methylene blue strain. What is it? It will show safety pin appearance more clearly. I have shown you in the slide already. This is the Vason methyl blue strain. And next is its cultures are the very hazardous, means it will cause us very dangerous. So it will be done only in the specialized equipment laboratories. Next is the Amino Fluorescence. It will detect the antigen in the cellular context using the antibodies. So organism is identified. Amino Fluorescence diagnose the only antigen. And serological test detect the antibody in the patient serum. So we can do also this test. So Vason methylene blue strain is the more specific, and the serological tests are the more specific test for this bacteria. Next is what is the treatment of this bacteria? Treatment is the streptomycin, first line anti-TB drug for pneumonic plague. We can give alone or with combination with the doxycycline. Protein sensitive inhibitor, we can also give the tetracycline group protein sensitive inhibitor, and also patient should strict quarantine, should stay at home for 72 hours, because this infection is spread 3 to 7 hours after the exposure. So you have to understand that. Next is the prevention. Control rodents population and avoid contact with the dead rodents. You can prevent it, and also you can give the tetracycline to the patients who are close contact to these rodents animals. Also, killed vaccine is available for the person who are a highly risk occupation. We can give the killed vaccine. Also vaccinate the pets to prevent this infection to human. So our lecture has finished, and now we will quickly review this lecture. Yersinia pestis is the basically gram negative rod related to animal sources, zoonotic, and it will cause diseases bubonic plague and pneumonic plague. It will cause skin related diseases, mesenteric adenitis, and cutaneous hemorrhages, black death. It will also cause the enterocolitis, sepsis, but it is very rare. Then habitat and transmission. Habitat is the animal sources, wild rodents, and also transmitted by the flea bite and pets. So this is the picture of rodents. This is the squirrels. This is the prairie dogs. This is the puppies, and this is the flea. And what is the pathogenesis? 3 main virulence factor envelop, 2 antigens B and W protein, and YOPS protein. The bubo is also formed on the skin, and exotoxin and endotoxin are also involved. Characteristics, we have seen small gram negative rods and one of the most virulent organism, bipolar safety pin staining. Then 4 characteristics are same for every family Enterobacter characteristics. Facultative anaerobes, reduce nitrates to nitrites, ferment glucose, and cytochrome oxidase negative. Next is this slide, and you can see that safety pin staining of Yersinia pestis. Then laboratory diagnosis, we have seen that it will show gram staining test, Vason methylene blue test strain, and cultures are hazardous. Immunofluorescence we can do for antigens, and serological test for antibodies. Then treatment, we have seen streptomycin we can give alone or with tetracycline group, or strict quarantine for 72 hours. Prevention, we can control rodents population. We can give tetracycline to the patient, to the close contacts, and also killed vaccine is available for the humans, and also vaccine is available for the pets. In this way we can prevent this infection. So as a whole, we have discussed all the main features of this bacteria. If you have any question related to this bacteria, you can mention in the comments. I will answer you. And also, if you have understand this language lecture, you should like this video and share this video to your friends. Also subscribe my channel and click the bell icon, and you will never miss an update in the future. And you can also follow me on my Instagram, Facebook, and social media accounts. Links are given in the description, and you will learn amazing knowledge from there. So we will meet in the next lecture soon. Goodbye.